Now, I'm going to be talking to Heather McFarlane today all about why she wants to train in head trash clearance. Heather is a CBT therapist as well as training in other things. And we're going to have a little bit of a talk about her own journey with head trash clearance and how you feel it can complement the work you do as a CBT therapist. Yeah? You up for that? I've just touched a little bit on your work, but if you wouldn't mind just introducing yourself for those listening, that'd be great.
Yes, so hello, my name's Heather, as you've said, and I've been a CBT therapist, cognitive behavioural therapy, for those who don't know, for the last 13 years or so. And I have become a supervisor of CBT students since then. So I do private work with clients and then supervise trainees as well. And I've used it on myself many times in the past for different issues, and then got involved with head trash clearance as well to work on issues, I guess, that couldn't really be cleared with CBT alone.
Yeah.
So that's why I'm here today.
Okay.
I've been working with Alexia for a year or two, a couple of years,
Yeah.
on and off.
So let's start then with the thing that we initially connected over, the reason why you ended up discovering head trash clearance on the things that you weren't able to get results with CBT. So do you want to just talk through how is it that we came to work together? What was the thing that you were wrestling with at that point?
Yeah, so at that point, a couple of years ago, I was torn whether or not to have a baby because I was terrified of the idea of being pregnant, of giving birth. Had tokophobia, which I discovered on researching mainly your work and other things online. And I thought I just never wanted children at all. So, but then I got married and we were talking about having a family, and I thought I need to make a decision here. And I tried CBT. I'd went for different therapy over the years, and nothing had changed. And I was in a panic, really, not sleeping, highly anxious. It was just a horrible time, actually. And that's why I reached out to you for help, because nothing else.
So you joined I think it was the Tokophobia Support Group. So I ran, so back then I was running support groups. I do one-to-one to tokophobia work, but that was a group program that you joined, wasn't it? And we did it over a month where everybody was clearing their own stuff together over the period of a month. So do you want to just talk through a little bit of how you found that experience? What was that like for you?
Yeah, it was so liberating in a way to be able to talk to other people who also had tokophobia, because I found nobody had ever heard of this, and I was sort of ashamed to talk about it and say it because it's weird if you're a woman and don't want a baby, in a lot of circles, which I'd always kind of fitted into that. So to find other people who had tokophobia, because I'd never come across anybody, was just an amazing experience to be able to talk openly, but also have the group to kind of keep you accountable. So it really focused you in on the program to work through your own head trash at the same time as kind of learning from other people. It was invaluable.
And did you find that some of your fears were shared by others, like you had common fears, or did you think that you were kind of alone with some of your fears? How do you feel that was for you?
Yeah, no, I thought there was lots of common ground. Before I joined the program, I thought I was completely alone.
Yeah.
However, on the program, there's really common themes, isn't there? It's lack of control, which I'm a control freak, absolutely. Anyone who knows me would say. So that's a really common theme. Yeah. And there was lots of that whole change within the body, being out of control. Definitely.
So in that month, so would you say, I mean, you're now a mother?
Yes, amazingly. If you'd asked me in January 2020 if I'd ever have a baby, I'd have said no, definitely not. But yes, now he has just turned 1, so I managed through that.
So during that month, you were able to what was the shift for you in that month as far as you're concerned? Like where was, you were starting where you weren't really able to contemplate having a baby, to at the end of that. And I think maybe you carried on some private work or like some work on your own, didn't you, after that? So you kind of you knew how to use it from then on yourself, so you continued. What was that difference that you noticed in yourself then?
Yeah, I mean, I'd say still at the end of the month, I wasn't set on having a baby still. But I wouldn't say it was all cleared within that month for me, although I know for a lot of people it is. But I continued to work on for a good few months after, before I really committed and made the decision to start trying for a baby. I've often reflected back, and I don't know, that's the mystery of head trash, I think. I don't know what changed, but all of a sudden I was less anxious, more open to it, was able to, say words that had terrified me before, even the words, even, the thoughts of some things related to pregnancy and birth terrified me, so I could start talking about it and saying those things without having a panic, which is a real change. And enabled me to think it through from a calmer place to be able to make the decision.
One way I describe the what the process does, it's almost like what our heart wants. We're able to, you can kind of, what you want, you often can't access that because there's just things just getting in the way. And so with head trash clearance, what I don't think, it doesn't kind of change you, it just kind of removes things that are stopping you from acting out your heart's desires. And so once they're not there, you're just able to move forward without that resistance, without the blocks, without the fears. Up until that point, all these things are standing in the way of you being able to do that. Does that resonate with you? Is that how you feel about what you experienced?
Yeah, absolutely. Because I think, I don't know if it was in a training pack or something you'd sent, but it was like this picture of just a head full of kind of spaghetti or cross thread or something like that.
That one.
It's in the front of the book, of course, that's what it is. Yeah, and that I just really resonated with, because that is what my head was like. And like I couldn't unpick it. There were too many fears.
Yeah.
I think the head trash clearance then allowed me to unpick them slowly, and one by one they kind of went. So you were left with, right, what do I really want here?
Yeah. So then you can make a decision that you could trust, that wasn't filled with fear. Is that how you feel about it?
Exactly, because that kind of spaghetti mush in my head was just all the fears screaming out the whole time, so I couldn't actually hear
what I
wanted.
So as a result of that, so as a result of doing that, amazing, you decided to then have a baby and then got pregnant. Now you've got a 1-year-old, which is just wonderful.
Yes, amazing, a miracle, I think. And anybody that knows me has always said, wow, you've had a baby like that. That is just insane, given where I come from before.
Yeah, I met somebody, I caught up with somebody recently, not that recently, but when I sort of let them know that I've got 2 kids, they were like, you have 2 kids, you were never going to go like it. I was like, wow, was it really obvious? Because I knew them like 15 years ago or something. I was like, was it really obvious back then that I was never going to be a baby person? And yes, here we are, 2 kids. So yeah, it's a transformation, isn't it? And it's incredible how you can bring about such a transformation. So as a result of that, then you decided to then train in head trash clearance because you felt it would, so tell us, why did you decide to train in head trash clearance?
Because I found it so helpful for myself, and I've as I say, I've worked in therapy for the last 13 years, so I am a great believer in kind of doing something and working through something yourself first, in order to be able to do it with other people. And I did CBT years ago, and found it quite helpful at that point as well, which is why I then went on to train in CBT. So with head trash, I thought, I could add this and I could help other people in a similar position to me, because as I said, I had felt so alone and isolated. I thought, could I kind of bring this out into the open a bit more and work with other women who are going through similar things, now that I know I need to know it works for me first before I would do it with anyone else.
Absolutely. So now, as one of the things that that some people come to me and ask me, especially other therapists, is how does it differ to other things that are out there? And the thing is, I'm very honest about my own background, and so I am not a therapist, and I don't claim to be a therapist. I don't call myself that. I call myself a therapeutic coach, because I always work with a goal in mind. So with tokophobia, it's like, you want to give birth to a baby, you want to get pregnant, what's getting in the way of you of achieving that? And so there's always a goal behind the work that I'm doing. Have we just cut out there?
You froze a little bit, yeah.
Did I freeze? I'll just say that bit again. So I've always been very honest about my own background, and I'm not a therapist and I haven't trained in therapy. And but I'm always, I call myself a therapeutic coach, because I always there's a goal in mind when I'm working with people, like what is it that you want to achieve and what's standing in the way of you achieving that. So my tokophobia work was very much, okay, you want to have a baby, what is getting in the way of that, rather than the therapeutic model, which maybe might look back to say, well, what's going on, what's happened in your past, and that model, that's never been my approach. So therefore, when people say to me, how does it differ to other therapies, I'm not really in a position to answer that question with any kind of clarity for them. And that's what I hope that you can help me with today. It's like, how does it differ to CBT in your opinion?
So I think I was looking at some of your materials recently when I was going over this again, and you described head trash as, or head trash clearance as an art.
Yeah.
Whereas I would describe CBT as more like a science.
Okay.
And that's the best kind of way I can differentiate it. And even when I was going through it myself, I couldn't quite grasp what was happening with the head trash. I just knew it was working. Whereas CBT, I think, is very much more in the conscious mind,
yeah,
and the clear processes.
Mm.
Whereas I would describe head trash as a bit more in the unconscious.
Yeah.
That's something that can't quite be grasped.
Yeah.
So those are the two main differences. But there's actually loads of similarities in it.
Are there? Like
There
what?
Which I found really interesting, because at first I would say, well, they're totally different things, and they are. But I guess CBT has different strategies, but we're both focused on the same goal. So it's very much goal orientated. That what do you want to change, and let's focus on doing that and taking the steps towards that, which I think both of them are.
Yeah.
CBT is also focused on the here and now. It's very mindful in that way, and being in the moment, as is head trash. What are you feeling right now?
As opposed to the story or what happened in your past. Is that what you mean by that?
Yeah. So it's focused more on how you're feeling right now, and connecting and tuning into physical sensations in your body. What are you thinking right now?
Yeah.
So CBT, kind of in a nutshell, is based on the idea that our thoughts, what we think in our head, our behaviors, what we do and how we react, and our emotions and physical sensations in the body are all interlinked. So they are all interlinked, and by making a change in one area, it has a knock-on effect on all the others. But we just kind of get stuck in negative patterns, either negative thinking patterns or negative behavioral patterns. So it's about recognizing them and changing them. That's the core of CBT. I guess I do a bit of other stuff as well, and I would look back a bit into the client's past to see where these messages have been learned. And I guess that's the difference. So maybe pure CBT is more focused on the here and now, whereas I would tend to go back and say, well, we learned that from somewhere, it didn't just pop into our head.
Yeah.
But with main focus in the present moment.
And I just wonder around the tokophobia, because the one thing that makes it very difficult for women to overcome tokophobia is the lack of knowledge and awareness around it. And many therapists simply don't understand the condition. And therefore, when it comes to untangling or treating it, they're driving blind a little bit, because they're just not quite sure how to navigate that terrain. And I just wonder, with what you've learned as part of your own journey, could you now look back and go, oh, actually now this is how we've untangled it. Could I now use CBT to do this? Or do you think that there's still aspects of head trash clearance that are kind of reaching parts that maybe CBT doesn't, and actually they just work really well together as a complement?
Yeah, I think so, because I think CBT is great, and obviously that's what I'm trained in, so I'm going to say that. But it is really good for maybe shorter term issues, less deeply entrenched issues.
Yeah,
exactly. Okay. And I think that's the problem a lot of the time, because certainly for my personal journey of tokophobia, I've been terrified for as long as I can ever remember. It's just something that's terrified me. So for those kind of deeply entrenched patterns, I would say that that's where head trash would come in. Because CBT, I think, gets a bit more surface level, or if it's just a smaller issue that hasn't been around for years and years.
Okay.
So I think that's where they would complement each other really well.
Okay. So do you see you being able to like weaving them, like when you're thinking about the work that you do, do you see yourself weaving them in almost seamlessly within a time with the client? Or do you think, oh, I'm going to put my head trash clearance hat on, oh, my CBT hat? Do you see them separate? Or do you think you're going to kind of get artistic with it and start blending?
I know, say I've always gone down the science route in the CBT, so this whole creative arty way is a new way of working for me, I guess. It very much depends on the client, I think. So they could definitely be intertwined and do a bit of both, because I think I do that with clients anyway. I do some CBT, but then I'll do some acceptance and commitment therapy or compassion focused therapy, or I pick from different things that I've learned over the years. And head trash is just another one that I think I would pick from. Unless someone specifically, I think, no, just head trash suits you, because it's what the client comes with and their personalities and what they want from the therapy, the way of working as well. So it would be different for everyone, I would say.
And in terms of I love the way the art aspect, and I definitely feel that the thing about head trash cleaners, I feel that if you want it to be super processy and you want to give the same client, every client, the same experience, you can just go through the process and just stick to that, then you absolutely can do that. Because I know that some people are very, very processy. I used to be super processy.
A bit like me,
where you're like, no, I don't want to get all creative. I just tell me what I need to do. Yes. I'm going to do that really well. And so if you want to do that, then you can absolutely do that with head trash clearance. But the more you get, and I think this is like with anything, the more you get familiar with it and you start really working with it, you realize that actually these are just guidelines. And as long as you they're just the perimeter fence of the field. And as long as you stay in the field, you're good to go. You don't have to kind of walk around on the running track. You can kind of cut across if you want and go outside the lines. And that's the artistic aspect, where the more you clear, the more your intuition can take over and you can almost be guided through that. And that's the artistic aspect that I think comes from lots of use. Does that make sense to you when I describe it?
And I think that comes with experience though, doesn't it? That and it was the same for CBT as well. I trained in this maybe structured, rigid method and would stick to that in the beginning, but then over the years, let's try something different and mix it up a bit. And as I become more practiced in head trash with other people, I've done it lots on myself, but I think I need to practice a bit more on other people to then get that artistic flair for it, I guess.
And so when you think about the main differences in terms of, you say that maybe head trash clearance can be used more entrenched or embedded or more subconscious or unconscious things. Are we talking around traumas, beliefs, conflicts? I mean, when you talk about some of these entrenched things, how would you describe some of the things that are kind of quite embedded?
So I guess it's our beliefs, or what we call, in CBT, it's core beliefs. It's these beliefs that we've had from a really young age, 4 or 5 years old, before we've even known. Whereas I know head trash would maybe go back even further than that, into the womb, or before. So that's maybe the difference, that CBT would look at the more conscious beliefs that underpin our anxieties. Maybe if we can't get to that, or it's not clear, then head trash would come in with that.
Because I think of head trash clearance being very good with what I call the value conflicts, where you are being torn, your values are pulling you in different directions, and they kind of pull against each other, and it's kind of almost like fizzling out that conflict that's creating this tug of war inside. And I've often put the question to some, in groups of therapists and coaches and people that kind of are informed on these matters or have a view and they're really educated, is, what do you think is the more, what's higher at the hierarchy in terms of importance of trying to heal? Is it beliefs over values? Is it values over beliefs? Is it neither? I don't know. Have you got a view on what holds the most power in terms of the challenges in our mind to heal? Are we best going towards beliefs? Is it is all the juice hiding in the conflicts? I don't know. Have you got a view on like what that looks like?
I guess I'm used to working with the beliefs more. That's really common ground for me with CBT.
Yeah.
Because our beliefs there are said to kind of underpin everything that we do and how we act and what we think of people and experiences in the world.
Yeah.
So that's my natural way to go. But again, I keep coming back to this, but I think it depends on the individual client. Okay. I really do.
Yeah.
That it depends just the importance they place on different things, because we're all different. And I really don't believe that one method fits all.
I
Which
agree.
is why it's so good to have all these different techniques and be able to be flexible and use them. So I wouldn't rigidly say it's values or it's beliefs or it's one thing.
Yeah.
I don't know if that's helpful. People.
No, it is helpful. It's interesting because some people have got very clear views on what that is, and when I kind of dig and try and find out a bit more about that, it doesn't sound like they've got a lot to support their view. So I was just curious to get your opinion, somebody that kind of works a lot with the belief side. And also, I guess a lot of the work that we would have done with the tokophobia was around the conflict in the values. And so that's really where a lot of once you clear the conflicts in values. And so, for example, those people that you're a self-confessed control freak. So being in control, very important. So control is a value, but also the bit that a lot of people fear, especially in the context of birth, but actually in all aspects of life, is not being in control, losing control. And so the threat of not being in control or losing control is a conflict with the value of being in control. And that where they meet in the middle, that's where a lot of that fear, the rub is the fear. And so by clearing all of these conflicts that are going on, this is how we are able to collapse tokophobia within a very short period of time. So I'm just, maybe the reason, question mark, and I don't know, maybe the reason we're able to go deeper with head trash is because we're looking at values. Because we didn't really do any belief work, did we, as part of the group program that you were in when we looked at tokophobia? I don't think we did we?
Yeah, no, thinking back now, probably not. And maybe that's been the issue, that's always been my focus in the past, and that wasn't enough in my case. And then we got down to it. Because you're right, and I guess there's some similarities there in terms of the values work, that this control or freedom or whatever your value is, that is, I suppose, what we call this kind of all or nothing type thinking in cognitive behavioral therapy, where you mustn't ever be out of control. Well, of course, you're going to be out of control in loads of situations in life. So it is about bringing yourself more into the middle, rather than feeding that extreme end. Because the problems start when you have that extreme form of thinking. Head trash is doing that as well, isn't it? Letting go of.
To create the neutrality where you can have that pace in the middle, where you can hold both simultaneously. Because you said all or nothing, and the way I see that in the work, in head trash clearance eyes, I go, a lot of people flip-flop. They flip between gotta be in control, and then if they're out of control, or they lose it because they've lost control of their emotions because they might be out of control, and they kind of flip-flop between these extremes, and they can't hold both together. Whereas when we create neutrality, we can actually hold both of them together, and which stops the flip-flopping. And that's where a lot of the anxiety, day-to-day anxiety, comes from. Because you imagine all these conflicts that you're juggling on a day-to-day basis. That's exhausting. And that's why a lot of people are struggling with things like anxiety, because they just have all these conflicts. That's the way that we look at it anyway with head trash clearance, is heal those conflicts in values. And a lot of that stuff just collapses very, very quickly.
Yeah, absolutely. And that's what I mean. I think we just use slightly different strategies to get to the same place between head trash and CBT. That CBT would talk about, more rational, realistic thinking, getting off of those extremes. Jumping or slot rattling between the two and coming to this middle. What is a rational, helpful thought, rather than these extremes which just increase the fear.
Yeah. And I'm thinking in terms of practicality, when you think about working with a client on using CBT versus maybe head trash clearance, how might that differ? Like, would the session length be the same, for example? So I imagine with therapists, they're like, well, I have an hour slot, and then you put the hour slot in, and suddenly, well, if I'm going to need more than that, it's going to mess up my diary system, for example. I'm just thinking, practically speaking, how do you see offering that and working with people? Are there any differences between how you think that might look practically from a therapist perspective?
I I think I would, yeah, because with my therapy currently, it's 50 minutes. That's it. And we're very time boundaried and structured.
Yeah.
Which is CBT in a nutshell.
Yeah.
So that translates into the session. Whereas with head trash, I might have a longer session.
Okay.
Certainly for the first one. Because I guess there's that bit of the unknown in a way, because if you're in the middle of clearing something and it takes longer, then you can't always put an exact number on it.
Yeah.
So I would probably offer longer sessions for head trash, but fewer.
Yeah.
Potentially.
Okay. So when you say a longer, what, an hour and a half, 2 hours? Have you got a sense of that?
Yeah, maybe probably about 90 minutes, I would think, just having gone through it myself.
Yeah.
I think just so that you're not rushed.
Exactly. I think there's some amazing stuff comes up. The insights and the aha moments need to land. And that's where a lot of the shifting happens, when they get the aha moments. So it's allowing that to breathe and to kind of emerge in its own time. And I think now that to reflect, I kind of agree with what you said. I think the first one I tend to have longer, so we talk about what we will need to clear, but then we've got very focused, because it's ongoing work. We're going to be clearing all this stuff together over the next however many sessions, so that when you come into that session, the next session, you're like, right, today we're going to clear XYZ. So when you know what you're doing, you don't have to do all the back chat and all the blah, 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 what's going on. You can just dive straight in. And that does enable you, I think, to keep it to an hour, but that doesn't allow for this space, which I think is an important part of the process, to allow the conscious to catch up with the unconscious work that we're doing. So I think 90 minutes is I would agree that that's a kind of a good time to aim for. I think that's what I'm finding works really, really well. And but sometimes it goes more than that. Sometimes I offer more than that, where we might, if we're on a roll, we might get 2 clearances done in 2 hours. So it depends on what you're doing and how the client wants to be, what time they've got in their diary, and what pace. You get to know the client a little bit. So I don't know if that's going to be helpful for people watching in terms. So in terms of the practical stuff, what you mentioned, that with head trash clearance, you might see people prefer, even though the session length might be longer, it might be for less time. So roughly, and then, of course, it's so difficult until you know what you're working with and what's going on for that client. But what could you sort of put some approximate kind of, what does that mean? Like, how long might you typically see somebody with CBT, and therefore what might you expect that to look like with head trash clearance, roughly? Because obviously we know that it could vary massively.
Yeah, it varies hugely depending on the issue they come with. And if it's one straight issue, anxiety, maybe 6 sessions possibly with CBT, if there's no underlying issues. But often conditions are comorbid, so you've got anxiety and OCD and depression all going on, and that interwoven again. So then you're going to work with someone on a much longer term basis. Also things like PTSD, OCD as well, tends to be longer term work. 20, 25 sessions. I mean, these are numbers, they're certainly not set. The thing is, I work quite flexibly in that way. Some people come weekly for 6 weeks, 8 weeks, but then would come fortnightly, or maybe just check in once a month and go away, and I'd give them stuff to do and then come back. So the gaps between sessions would get longer, because I never want someone to become dependent on therapy, where they're coming for years and years and years. And that's not the type of therapy that I do. But people will certainly check in. They might come back 6 months later for a check-in, and as time goes on, if they want to.
So you mentioned you give them stuff to do. The way that I work with my clients is because I want people to get results as quickly as possible. And also they can't always afford for me to do all the clearance work. So I always share with them the DIY version of the tool, so that they're able to do clearance on their own, which means we're able to get results much, much quicker. So they're expected. I set that up at the beginning. I make that very clear that that's how I work. Obviously not everybody's going to want to work that way, and it doesn't need to be that way. So I give my clients stuff to do, and they've got their clearance work, and then they can check in with me in between to see how that's going for them, and if there's anything come up, which I see that might not always work for all therapy, because you don't want your clients constantly messaging you going, what the hell, is that is that how you see yourself using head trash clearance? Or will you give them clearance homework, or are you going to think maybe just do all the clearance for them? How do you see that emerging? Have you got an idea at this stage?
Yeah, I think I would continue on doing kind of homework, because
Yeah.
I've always done that, and I think it's helpful because it invests the person in making change themselves. It's not me doing the change, it's the person themselves, and that needs to go into their everyday life, and they need to get confident with the technique, doing it so that they can use it as time goes on. Whether it's CBT or head trash, that's the way I work. I'm about educating people, and there's a lot of education within CBT. Go away and practice this technique and come back. I guess I'm maybe seeing people for weekly or for longer with CBT. If you've got depression, for example, and there's a very low level of motivation, for someone like that to go away, they're maybe not going to keep focused on the work. So more sessions as almost to keep them accountable, and check-in is helpful in cases like that. Or with OCD, when you're working through a kind of hierarchy, keep coming back, because if it's so overwhelming, people sometimes like that check-in, and that's that more intense support. But it depends on the individual again.
No, I find that too. Sometimes people need a lot more of that one-to-one support, especially when I've worked with people with high level with tokophobia that's very, very strong. They simply really struggle to clear the first few things because it's too much. Fears are too strong, and they're too terrified of their own fears for them to be able to do that on their own. So that I would do those early ones, and then gradually their resilience builds, and they're able to then start taking some of that workload themselves. And by the end, they're kind of owning it and doing it. They can do it on their own. So it sounds like there's a very similar approach going on. Is there anything else that you think, for those therapists that are thinking, oh, this sounds like this could be interesting for me to train in and add to my toolkit, is there anything that you'd like them to consider or to think about to help them decide whether or not this might be a good one for them to take on board or to train in?
I would say you have to do it on yourself, first of all, to really get a feel for it and see if it's worthwhile, because I think it is linked into that unconscious a bit more. It's maybe a bit harder to grasp how the change happens unless you're doing it on yourself. You can't just really read it from a textbook. Which I guess some therapeutic approaches you can. So I would go through the whole process first on your own.
And the training requires that, actually. The first part of the training, everybody has to clear a minimum amount before they're able to carry on with the training, because I sort of force that because I want people to have experienced it at a deep level, because I think that makes you a much better practitioner. You're much better able to support your clients if you've cleared your stuff, you've experienced that journey, because you can spot the stuff in them much more easily. So for those that think, but also that means that those that are wrestling with things like anxiety or whatever, you get a lot of personal work done on yourself at the beginning, which really just improves. I've had some people saying, my God, I've just completely transformed just in the first part of the training because I feel so much better in myself. So I insist on that, because I think it's an important thing for therapists, for change workers, whatever you want, coaches, to really to walk the talk, basically, and make sure that they are examples of what they do, because I think that's important for me to be able to train people like that. So for those that don't, but otherwise people can just buy the book and try it out themselves. So thank you, Heather. Is there anything else you'd like to share? Anything else you'd like to share with potential therapists that might want to train? Anything else you want to say on anything? Maybe I've not asked you something. I don't know. Is there anything else?
No, I think we've covered just about everything. I would say just give it a go. I mean, as at the beginning, I can't really explain why it worked. I'm still learning that part. But it is a really interesting addition to whatever therapy you're already doing, or just to do this one if you're not already trained in therapeutic approaches.
Thank you, Heather, so much for your time today. Really appreciate it.
You're welcome. Thank you for having me. It's been really interesting.